For our first company presenter session, if all the companies could assemble here in the auditorium. And in a moment, I'll introduce you to our moderator. If folks could take a seat, if I might ask you in front of the projector there, if you could actually take a seat. Rather than my actually reading this off to you, I want to make sure folks know this is an SEC statement regarding the information that you're going to be seeing today. So if you could take a quick second to take a look at that, I won't have to read that off for you. And again, this is the first of our 2 company presenter sessions. We're very pleased to show you some high-quality investment opportunities in these sessions. Again, in terms of your cell phones, if you could put those on vibrate or silence them and take your calls in the hallway, that would be terrific. For this first session, it's my pleasure to introduce our moderator. For this high-tech company showcase, Tom Kaczarski, the president and CEO of Buffalo Niagara Enterprise, one of our wonderful and generous contributors and organizers, will be moderating. Let's please welcome Tom Kaczarski.
Good morning, everyone. Good morning, everyone. Come on, it's a great day here. Let's liven it up. First of all, Brian, Scott, where did Scott go? And Marnie, thank you for being the presenting sponsors and really saving this event and keeping it going. They deserve another round of applause. Well, I appreciate the invitation to participate this morning in the company showcase and learn from the presenters. In our business, that's the fun part of working with companies, is working with so many new and creative ideas. And I also look forward to networking with all of the investors that have graciously attended today. As you may or may not know, we are the 8-county business attraction, marketing, and business recruitment organization for the greater Western New York region. And we certainly know, as sometimes we get acknowledged as the elephant hunter going after the big companies, we know the critical role that small business and entrepreneurial development plays in our region, especially during these challenging times. Information technology, advanced manufacturing, life sciences, and renewable energy are key clusters for us, and we've committed significant resources to ongoing attraction and development of those clusters. And just to that end, while we are here talking about much needed capital and connecting and networking, there are very valuable resources, as Mayor Deister mentioned and Mayor Brown mentioned, that can help companies succeed. And we're one of the agencies that can help you work through what may seem to be a maze of programs and get you connected with the right folks. So we offer that to you. This morning, we have some ground rules. I am the time cop. Well, actually, I'm going to have assistants. Each company, in the spirit of fairness, is going to get 10 minutes to present. And we're going to have a volunteer waving at 5 minutes, 2 minutes, and 1 minute. And when you see me up front rubbing my globe, that means you got about 30 seconds, and I'm coming up to the stage. So the companies that are speaking will be available after the presentations at their tables and outside during the breaks for further discussion. So without any further ado, our first company will be Michael Zwick, the CEO, presenting the CEO of AndrBio. Mike, you are on the clock.
So thank you very much for giving us the opportunity to present today. I am the CEO of AndrBio. We're a biotech company here in Buffalo. We are a spinoff from Roswell Park Cancer Institute, and I am a Western New York native who is very excited to be back here for this opportunity, and it's actually very exciting to be a part of this event. We were a part of it last year too, and to see the growing interest in the innovation sector here in Western New York. I think it's a great thing that's happening. So more about us. So we have been active as a company for about 3 years now. We signed an agreement with Roswell in 2007, initiated the company from technology that was developed at Roswell with quite a bit of substantial funding, about $35 million in past funding in prostate cancer, which is one of our focus areas. The two founders of the company, Gary Smith and Jim Moeller. Gary's with us here today, and so if you'd like to speak with him, besides myself, we'll both be available. The problem that we're dealing with primarily is prostate disease. So benign prostate enlargement, also known as BPE or BPH, affects about 50% of men 50 and older, so it's a very large target population. Prostate cancer, as most of you are probably aware, is one of the more prevalent cancers. Male-specific, of course. There was over 200,000 estimated new cases in 2010, over 32,000 deaths, and there are over 2 million in the U.S. alone living with prostate cancer today. The growth rate of prostate disease in the target population is increasing quite significantly. It is like most cancers and many diseases, is more common as the population ages. Pharmaceutical treatments for this disease sector exceed $5.5 billion, and surgical intervention costs over $4 billion. So obviously, it's a very large market that we're addressing here. Androgen deprivation therapy has been the standard of care for over 60 years. And so what you'll see with what we're doing is we're looking at some very innovative new approaches to treating this disease problem. So our business model is a little bit unique. As you can see, we kind of have two sectors. We have a fee-for-service. We have a very novel, innovative assay platform that we use human tissue to test drugs for other companies. This, of course, is a revenue generator for the company. It's a proprietary assay that we use, and we access prostate, breast, and kidney tissue, and we anticipate expanding this program to include a whole plethora of cancer-related tissue options for assays. On the drug development side, we have 3 different approaches to prostate cancer. Many of these are relevant for other types of diseases as well. The unifying theme in most of what we do is that these are hormone-driven diseases and rely on hormones to stimulate the cancer or the growth of the tissue. And then additional revenue from related services and applications. So one of the primary drivers for what we're doing is the high cost of drug development. Everyone knows now with the healthcare sector, costs are escalating. It's very expensive to develop pharmaceutical drugs. We're addressing that problem in 2 ways. In the contract research segment, our contract research model here, we position that right between the traditional way of developing drugs, that is early stage discovery and typical animal models, and then going into the clinic. And as you can see, the cost of clinical trials is where the real cost escalates quite significantly. So we believe by using our unique human tissue-based model that we can reduce the cost of drug development and, again, weed out drugs that aren't going to be efficacious when they reach the point of testing in humans. The status of the company, as I mentioned, we've been active as a company since 2007. We've been awarded 4 Phase 1 SBIR STTRs. These are grant programs that many of the federal research programs sponsor. They are specifically for small companies like us. Many companies take advantage of this. They're very competitive, but we've been quite successful with that. We use that money to leverage against investment. So as you're going to see, what we've been able to do is match and actually now exceed the amount of investment money that we're taken in with the grant money, which is non-dilutive. We have over $5.8 million in outstanding proposals right now, and very exciting news for us. Quite recently, we were just awarded our first Phase 2 grant on one of our research programs. So that's a significant milestone for the company. So the programs, we have 4 active programs at the company. The contract research program that I talked to you about, we call it the Angiographic program. And this is where we test drugs for other companies in this human tissue model. The unique thing about this model is that we're testing drugs against actual human blood vessels. So this is targeting angiogenesis, which is blood vessel formation. It's a common target for cancer, but many other drug development programs also use angiogenesis as a model. Therapeutic programs, we have 3 innovative programs to attack prostate cancer: androgen blockage, prostate imaging and vascular targeting, and cancer stem cells. The cancer stem cells is the program that was just awarded the phase 2 grant. So a little bit about each of those. The angiographic assay. The reason we do this, the existing models are very poorly predictive. There's over 200 biotech and pharma companies, that's our target sector, that are active in this area for research. There's over $4 billion spent in angiogenesis research to date. And Avastin, one drug that's on the market now that you may have heard of, has revenues of almost $6 billion in 2009. So it's a very large market drug. Target population in the U.S. is 14 million. We had a market report done for us a couple of years ago, and it predicted that for the cancer angiogenic market alone, revenue should exceed $4 million about 5 years out. And we believe it can be expanded to a full panel of cancer tissue targets. The androgen blockage program, the disease areas that this affects are, again, benign prostate disease, prostate cancer, male pattern baldness, and acne. So each of these are very, very large markets in and of themselves. The target also has diagnostic potential as well. Current treatments have significant side effects that impact quality of life and are not curative. The drug target has been established, and one of the drugs on the market, Avodart, you've probably heard of. So it's established the market. It's a small molecule drug. And the revenues for Avodart alone should exceed $1.5 billion this year. The imaging program, the reason for this is the prostate as an organ is difficult to image. There are multiple cancer foci in prostate cancer, so it's not like you would eliminate one piece of cancer tissue. It's multiple cancer foci that need to be eliminated. We're using nanoparticles to image, and in quite an innovative approach, potentially heat kill the cancer tissue. So a non-invasive way to treat prostate cancer. Potential for targeted drug delivery. We do have a product development agreement in place now with a company that we've been working with for a couple years down in North Carolina. And again, the market for this is quite large. Surgical and radiation therapy intervention now exceeds $4 billion, and that's a dated number. Cancer stem cells, these are a very innovative approach to prostate cancer. People use the analogy of perhaps a dandelion, so a weed, where if you don't pull out all the roots, the cancer will regrow. So the cancer stem cells are a subsegment of that population that are resistant to chemotherapy, radiation, and responsible for metastasis, that is migration of cancer to other organs. This program has a diagnostic bent as well as a therapeutic. The diagnostic would be first to market. PSA test revenues alone exceed $350 million annually. So our funding request is for $2 million. That would be to accelerate 2 programs, primarily the androgen blockage program, for which we don't have grant revenue right now, facilities, equipment, marketing, and sales support. This is prediction of revenues, and we're running low on time, but I will say from the SBIR grant perspective, we're over 90% there. And so, since I've run out of time, I will just conclude with saying thanks to all of you for listening. Thanks to all of our current investors, and we will all be available today if you have any questions. Thank you.